After you make an appointment with the Fertility Center of San Antonio, you will receive an email. In the email, you will have information telling you how to get records from your other medical providers. Once we receive your release of medical records, we will make sure to get the medical records from your OBGYN or your primary care physician so that our physician has them prior to your appointment. We know the first appointment at the fertility center can be overwhelming. There's a lot of information, a lot of questions to be asked. So in order to streamline that for our patients, we ask that they fill out their patient portal ahead of time so that whenever they come in, it's as easy as possible for the doctor to access those medical records. We prefer to have your medical records in our office the day before your first appointment at the fertility center. Currently at the Fertility Center of San Antonio, we are offering two types of initial appointments. You can opt to do a telemedicine consult where you do a video chat with one of our physicians from the comfort of your own home, or you can choose to come into the office for your first appointment. If you choose to come into the office, there will likely be some sort of blood work and there will be a pelvic ultrasound. If you choose to do the telemedicine option, then you will call us with the first day of your cycle, and we can do the testing at that time. At your first appointment, you will meet with one of our doctors. They will do a pelvic ultrasound. They will also review all of your history that was gained from your OBGYN or your primary care physician. Once all of that is done, you will meet with one of our nurses who will give you a step-by-step checklist. And that checklist tells you exactly what you need to do in the next weeks before your complimentary reconsult. Before you leave our office, you will also meet with our business office, and they will go over all the financial aspects of your fertility treatment. After you have your initial appointment with the Fertility Center of San Antonio, some of the diagnostics that are asked of the patients are blood work. It's usually routine blood work along with some hormone levels. We will also ask patients to have a hysterosalpingogram, which helps the doctors make sure that the fallopian tubes are open. We need the fallopian tubes to be open to make sure that the sperm can swim up the uterus and meet the egg. Another exam that is often done is a saline hysterogram, and that one is to make sure that the uterine cavity is clear. And by clear, I mean that there's no polyps that could prevent an embryo from implanting in the uterus. And the last most common diagnostic analysis that we would ask a couple to complete would be a semen analysis from the male partner. And this is done to rule out male factor infertility. Time is of the essence in the fertility world, and the sooner you get in here, the sooner we can help you achieve your dreams of having a family.